Management of medically compromised patients in a dental setup. In this video, we'll be looking into the introduction and we'll be discussing in brief about the dental considerations in diabetes, hypertension, cardiovascular diseases, respiratory diseases, renal diseases, epileptic disorders, allergies, and pregnancy. Introduction. There is an increasing population of medically compromised people in the community. Most will require dental treatment at some stage. Many chronic disorders or their treatments require alterations in the provision of dental management, and failure to make appropriate treatment modifications may have serious clinical consequences. Thus, dental management in medically compromised patients is a very important aspect in daily practice. The key to successful dental management of a medically compromised patient is a thorough evaluation of the patient's medical condition or his or her medical history. Diabetes. It is a chronic metabolic disease characterized by elevated levels of blood glucose. It is classified into type 1 and type 2. Type 1 is due to insulin dependence and type 2 is due to insulin resistance. Type 2 is the most common type. Dental considerations. In general, morning appointments are advisable. The morning meal should not be skipped. In case of controlled diabetes, no special treatment modification is required for routine dentistry. In case of moderately controlled diabetes, if a major procedure is planned, for example, multiple extractions or periodontal surgery, an antibiotic should be prescribed following the therapy. Following the procedure, the patient's food intake should include the proper caloric content and protein-carbohydrate fat ratio to maintain the glucose balance. In case of uncontrolled or brittle diabetes, only acute dental infections should be treated on an outpatient basis. Delivered anesthetic should not include epinephrine. Antibiotics should be prescribed following the treatment and monitored carefully for sensitivity and efficacy. The most common complication encountered in a diabetic patient is none other than hypoglycemia. In such cases, dental treatment should be terminated and oral glucose should be administered. If the patient becomes unconscious, medical assistance should be quickly sought, or immediate delivery of 25 to 30 ml of 50% dextrose or 1 mg of glycogen should be delivered intravenously. The post-treatment problems can include delayed healing and infection. Hypertension. It is defined as having systolic blood pressure of more than 140 mm of mercury or diastolic blood pressure of more than 90 mm of mercury. Patients with hypertension are at increased risk of suffering from angina pectoris, myocardial infarction, stroke, and heart failure. All of these are medical emergencies which can occur during and after dental care. Dental considerations. No patient in dental clinics should be treated when the diastolic pressure is over 100 mm of mercury and systolic pressure over 180 mm of mercury. Antihypertensive drugs may cause certain oral side effects like gingival overgrowth, lichenoid reaction, xerostomia, orthostatic hypotension, etc. Prolonged use of certain NSAIDs like ibuprofen, indomethacin or naproxen is shown to reduce the effectiveness of certain antihypertensive drugs like beta blockers, diuretics, ACEs, etc. Aggressive dental surgical procedures should be performed with great caution in these patients because they are at a high risk of excessive bleeding. A common recommendation is to limit the epinephrine dose to 0.04 mg in adults. This is equivalent to use of one cartridge of anesthetic containing 1:50,000 concentration of epinephrine. Now let us look at various cardiovascular diseases and their dental management. Ischemic heart disease, also known as coronary heart disease. This occurs when the blood flow to the heart muscle is reduced because of a partial or complete blockage of the arteries supplying it. Ischemic heart disease includes two conditions, angina pectoris and myocardial infarction. Dental considerations. Patients who have a history of myocardial infarction less than 6 months prior to the dental consultation should be deterred from elective dental care. Dental treatment should be intended to provide odontogenic pain relief only. The patients with angina in the ambulatory setting should not be sedated. The dentist should regularly check the patient's heart rate and blood pressure during long appointments. Patients on nitrates should be asked to bring their medications for each dental visit, and the dental emergency kit should always consist of sublingual nitroglycerin. Anticoagulants and antiplatelet drugs used in the prevention of atherothrombosis can be associated with increased perioperative bleeding during dental surgical procedures. However, stopping these drugs can result in serious thromboembolic complications. Hence, it is advisable not to discontinue these medications when performing minor surgical procedures. Instead, local hemostatic measures can be followed. Cardiac arrhythmia refers to a group of conditions that cause the heart to beat irregularly, either too slow or too quick. The best example is atrial fibrillation. The general considerations include physician consultation prior to dental treatment, stress reduction protocol to be followed, and limited use of vasoconstrictors. Patients with dysarrhythmias may be managed with electronic devices like cardiac pacemakers, implantable cardioverter defibrillators, etc. Patients with such devices should be observed with caution because these devices have shown to be sensitive to electromagnetic signals produced by dental instruments like an electrosurgical unit, electric pulp tester, electronic apex locator, ultrasonic scalers, etc. Valvular heart disease. Patients with valvular diseases may be susceptible to an infection on or near the heart valves by a bacteremia. This is termed as infective endocarditis. Though this is not an emergency condition in the dental clinic, the bacteremia associated with dental treatment can contribute to this potentially fatal disease in patients with valvular heart disease. Dental considerations. The antibiotic regimen as per the guidelines from the American Heart Association before a dental procedure in patients with high risk of infective endocarditis is given in the table. 2 grams of amoxicillin 30 to 60 minutes before the procedure. If the patient is unable to take oral medication, ampicillin or cefazolin or ceftriaxone can be given through intramuscular or intravenous route. If the patient is allergic to penicillin, cephalexin, clindamycin or azithromycin can be given. If the patient is allergic to the penicillins and unable to take oral medication, cefazolin, ceftriaxone or clindamycin can be given through intravenous or intramuscular route. An important point to be noted is that cephalosporins should not be used in a patient with a history of anaphylaxis, angioedema or urticaria with penicillin or ampicillin. Maintaining good oral hygiene and eradicating dental disease is shown to decrease the frequency of bacteremia from routine daily activities. Dentists treating patients with prosthetic valves must consider management of peri-procedural anticoagulation since thromboembolism is a devastating and often catastrophic complication of valve replacement surgery. Heart failure. It is a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. This causes blood and fluid to back up into the lungs, the buildup of fluid in the feet, ankles and legs called edema. Tiredness and shortness of breath are also evident. Dental considerations. The patient should be placed in a semi-supine position with the control of body movements. Sudden change in body position should also be avoided in order to prevent orthostatic hypotension. It is advisable to avoid vasoconstrictors in patients receiving digitalis as it can be precipitating cardiac arrhythmias. Since aspirin can lead to sodium and fluid retention, it is prudent to avoid it in patients with heart failure. Patients on anticoagulant therapy. Anticoagulant treatment is very common in cardiac patients. For a healthy person without anticoagulant treatment, the international normalized ratio, that is INR, is equal to 1. Anticoagulant treatment brings the patient's INR values between 2 to 3. However, dental treatment can be performed safely in the therapeutic INR range of 2 to 4, where the risk of bleeding is significantly small. Dental considerations. Oral anticoagulants should not be discontinued in majority of the patients requiring outpatient dental surgery, including dental extractions. This is because discontinuing oral anticoagulants can lead to serious thromboembolic conditions. In such cases, the risk of bleeding can be minimized by use of oxidized cellulose, collagen sponges, and sutures. 5% tranexamic acid mouthwashes can be used 4 times a day for 2 days. Patients taking warfarin should not be prescribed with non-selective NSAIDs and COX-2 inhibitors as analgesia following dental surgery because it can interfere with the mechanism of action of such drugs. Hemophilia. It is usually an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. People with hemophilia have low levels of either factor VIII or factor IX. Dental considerations. It is essential to prevent accidental damage to the oral mucosa when carrying out any dental procedure by the cautious use of saliva ejectors, protection of soft tissues during restorations, and taking care in the placement of X-ray films. Aspirin and its derivatives must be avoided. Resorbable sutures are recommended if needed. Endodontic therapy is preferred over extraction whenever possible, as endodontic treatment generally has low risk of bleeding in patients with hemophilia. Working length of the root canal is calculated precisely to ensure that the instruments do not pass through the apex of the root canal during root canal treatment. There is a risk of bleeding with the use of matrix bands or wooden wedges during restorative treatment. So care should be taken and bleeding can always be controlled by local means or by the application of topical agents. A rubber dam is used to prevent soft tissue lacerations. Respiratory diseases can be categorized into obstructive and infiltrative pulmonary diseases. Obstructive pulmonary diseases include chronic obstructive pulmonary conditions like asthma, chronic bronchitis, pneumothorax, and emphysema. Infiltrative diseases include inflammatory changes in the alveolar walls. Any respiratory disease is first characterized by dyspnea. Dental considerations. Late morning or late afternoon appointments are advisable. Patients should have their routine medications in each appointment and stress reduction protocol should always be followed. Improper suction tip or cotton roll placement, prolonged supine positioning or enamel dust can trigger reactive response. Rubber dam should be judiciously used. Patients who are receiving or who recently finished taking long-term corticosteroid therapy might need antibiotic prophylaxis. Renal diseases. Chronic renal disease is a condition characterized by a gradual loss of kidney function over time. Oral diseases and dental procedures create bacteremia, which may lead to morbidity and potential mortality in patients with renal failure or on dialysis. Pharmacological considerations. Drugs like aminoglycosides, tetracyclines, and aspirin should be avoided because they are known to cause nephrotoxicity. NSAIDs require dose reduction or complete avoidance in advanced renal failure as they impart a hypertensive effect. Benzodiazepines do not require dose adjustments, however, excessive sedation may occur. Medications primarily metabolized by the liver, including narcotics like codeine, morphine, fentanyl, do not require dose adjustments. Hemodialysis patients should receive elective dental care on non-dialysis days. Heparin should be eliminated from the circulation prior to treatment. Local and additional hemostatic measures must be available. In case of transplantation patients, elective dental care should be avoided within first 6 months after transplantation. Antibiotic prophylaxis is necessary before invasive dental care. Epileptic disorders. The main factors of consideration in these patients are to maintain adequate cerebral perfusion intraoperatively and postoperatively, and to control any seizure episode during this period. Usually, patients with seizure disorders do not pose a great problem for intraoperative management except for cases of status epilepticus where there can be life-threatening complications. Dental considerations. Stress reduction protocol should always be undertaken. Care should be taken while performing dental treatments because the dental light can be a trigger too. During an epileptic attack, remove all instruments and foreign materials from the mouth. The chair should be in supine position and patient should be turned to one side. If the seizure continues for more than 5 minutes, administer 10 mg of diazepam intravenously or intramuscularly or 5 mg of midazolam intravenously or intramuscularly. Emergency medical services should be called immediately. Some drugs can jeopardize seizure control. For example, metronidazole, clarithromycin, and antifungals. Allergies. Anaphylaxis is a severe and potentially life-threatening allergic reaction that can occur in the dental practice. There are a number of dental-related causes including mouthwashes, local anesthetics, latex, and antibiotics. The dental team must be able to respond effectively and manage the life-threatening situation appropriately. Dental considerations. During an anaphylactic shock, if the patient is conscious, they should be laid flat with the legs elevated. If the patient goes unconscious, cardiopulmonary resuscitation should be performed immediately. Adrenaline and antihistamine like a diphenhydramine should be administered. The patient should be reassured and the vitals should be monitored regularly. If the patient is allergic to certain drugs, alternative drugs should be prescribed. For example, in case of penicillin allergy, aminoglycosides like erythromycins should be prescribed. Pregnancy. It is a dynamic physiological state which is evidenced by several transient changes. These can develop as various physical signs and symptoms that can affect the patient's health, perceptions, and interactions with others in the environment. The dental management of pregnant patients requires special attention. In the first trimester, the patient should be educated about the maternal oral changes that occur during pregnancy. Strict oral hygiene instructions are to be emphasized in order to control plaque accumulation. The dental treatment should be limited to periodontal prophylaxis and emergency treatments only. Routine radiographs are to be avoided. In the second trimester, the patient should be positioned properly on the dental chair, preferably onto her left side, and the head of the chair should be elevated to avoid compression of major blood vessels. Oral hygiene instructions and plaque control should be emphasized. Scaling, polishing, and curettage may be performed if they are necessary. Active oral diseases have to be controlled if there are any. Routine radiographs are to be avoided. In the third trimester, oral hygiene instructions and plaque control should be emphasized. Scaling, polishing, and curettage may be performed if they are necessary. Elective dental care should be avoided in the second half of third trimester. Routine radiographs should be avoided. However, they can be used selectively whenever they are needed. Thank you.